Member for Peace River South.
Thank you, Mr. Chair, and it's an honor to speak today on this motion. I'll tell you, it's a very weird place we're in right now when we're looking at this motion, because if you ever want to use the analogy of putting your head in the sand and not realizing what's really going on, I think what we're hearing from the NDP members today is exactly that. Because when you look at healthcare in the province of British Columbia, it has never been worse. Crisis is used over and over and over again. And the only thing that I want to really point out when I look at this motion, first of all, finally, maybe because it's an election year, maybe it's because of all the pressure, but to have a motion that is basically put in front of us saying that the government recognizes they need to relieve the pressures of the in British Columbia's healthcare system and increase access to healthcare services. Well, no kidding. Well, no kidding. No kidding we have to do that. But why did it take to 7 years right before an election that the government is acknowledging that there's a crisis in British Columbia, when in fact we have 1 million people? The member can keep listening to me from Vernon-Monashee. I've got some good facts she might want to listen to.
One member has the floor again.
Honourable Chair, 1 million people in the province of British Columbia don't have a family doctor. People in rural British Columbia, like the member from Vernon-Monashee, who actually recognize the fact that their people are struggling with the longest wait times in North America in order to see medical services. So it's unfortunate they didn't want to use their time when they were up to actually talk about the facts of what people are faced with right now in the province of British Columbia. But, Honourable Speaker, I want to bring it closer to home. To put it in a reality and actually put some personal stories to this, that people need to be aware of, because these stories are in every corner of the province. Well, I guess not in Maple Ridge Mission. Supposedly, you know, unicorns, rainbows, everything's perfect in the medical system there. But Honourable Chair, almost every single week, I'm being notified that the hospital in Chetwynd is having to be shut down because of diversion, because of lack of staff. Almost every single week, I'm being told that the ER in Dawson Creek, again, is reading a record. It's a record, but that's the longest wait times in order to see somebody in the ER because of the struggles they're faced with there. Last week, I heard from a person in Tumbler Ridge who is trying to do, I would think, a very simplistic ask, which is he needs his heart medication renewed, heart medication that he's been on now for 10 years. And he gets a 3-month prescription. His prescription ran out, and he was told he has to wait 6 weeks before he can get that prescription renewed for his heart medication. How is this the British Columbia that we should be proud of for our medical system when it's utterly failing people from corner to corner? I'll tell you an easy thing we could do, and we started calling for this over 2 years ago. Let's get all the unvaccinated healthcare workers that were let go by this province, get them back to work. There's a quick and easy way that we can actually fill some of those gaps. You know, we have pressures all over, and there's one thing that we can do. Now, I don't know if it's this government's stubbornness or their lack of understanding, or if the science is different for this health minister and this government than everywhere else in North America. But everywhere else they've said, okay, we need to let these people back. These COVID restrictions and mandates are no longer needed, except here in British Columbia. Why is that? Well, yeah, we keep hearing they want to say science. Well, somehow it's different here. Well, I'll tell you right now, in places like rural British Columbia, in places like Chetwynd, Dawson Creek, Tumbler Ridge, and everywhere else in rural BC that are struggling to find nurses, there's a quick way they could do it rather than government being stubborn on this specific topic. And with that, you know, I want to use my last 30 seconds, Honourable Chair, to really highlight when I met last week with BC Nurses Union, and they reminded me, and I think we should all be talking about this, we should be reversing the order. It's retention and recruitment, not the other way around, because we should be thankful for the nurses and the frontline workers and the doctors that we have right now working in the province of British Columbia, and we should be doing everything we can to thank them, to make their lives as easy as possible in a stressful situation. And one of the things we can do is make sure that we're stepping up to the plate, recruiting more people, and helping our people in the province of British Columbia in the biggest crisis in healthcare we've ever seen. Thank you very much.
Member